Neurofibromatosis is a group of genetic disorders characterized by the growth of tumors in the nervous system and skin. It is caused by mutations in specific tumor suppressor genes, leading to uncontrolled cell growth and tumor formation. This condition can be inherited or due to the spontaneous mutation of genes. Based on clinical manifestations, neurofibromatosis can be broadly classified into neurofibromatosis type 1, NF1, neurofibromatosis type 2, NF2, and schwannomatosis. NF1 is caused by a loss-of-function mutation in the neurofibromin 1, NF1, gene, while NF2 is caused by a loss-of-function mutation in the neurofibromin 2, NF2, gene. Schwannomatosis is a rare type of neurofibromatosis caused by a mutation in the SMRCB1 or LZTR1 genes. A significant concern for individuals with NF and schwannomatosis is the increased risk of developing tumors. Although most tumors are benign, they can also be malignant. Understanding this risk is important because it enables early detection and intervention. Also, it helps patients and families make informed health and lifestyle decisions. Patients with NF1 have an 8 to 13% lifetime risk of developing malignant peripheral nerve sheath tumor, MPNST, especially between 20 to 35 years of age. These cancers are hard to detect, metastasize widely, and often have a poor prognosis. There is also a high chance of brain cancer, ovarian cancer, melanoma, non-Hodgkin's lymphoma, thyroid, bone, and lung tumors. Additionally, women below the age of 50 have a 5 times higher risk of developing breast cancer, while gliomas are common in children. Research has shown that these malignant cancers decrease the life expectancy of people with NF1 by an average of 10 to 15 years. On the other hand, NF2 is less common and has a lower likelihood of malignancy than NF1. Patients are predisposed to developing schwannomas, meningiomas, and ependymomas, tumors of the central and peripheral nervous systems. They can also have cutaneous tumors. Schwannomas typically affect both vestibular nerves, leading to hearing loss, deafness, dizziness, imbalance, nausea, vomiting, and vertigo. Other symptoms due to tumors include cataracts, headaches, seizures, pain, muscle weakness, and paresthesia. In rare cases, ependymomas, usually found in the brain and spine, can be malignant. Schwannomatosis is associated with a lower occurrence and cancer risk compared to NF1 and NF2. The primary tumors in schwannomatosis are schwannomas, which are typically benign. It is often mistaken for NF2 because patients present with schwannomas in both cases. Schwannomatosis is characterized by the presence of multiple non-vestibular schwannomas, while NF2 is marked by the presence of vestibular schwannomas. Chronic pain is the hallmark of schwannomatosis and can significantly impact quality of life, even in the absence of malignancy. Malignancy is extremely rare but may occur in patients with mutations in the SMRCB1 gene. Early detection of tumors in neurofibromatosis, NF, and schwannomatosis is critical for improving patient outcomes and reducing morbidity. Given the high risk of both benign and malignant tumors in these conditions, regular surveillance allows for timely intervention. This can prevent complications such as neurological deficits, functional impairments, and cancer progression. Diagnosis is made by physical examination, family history, genetic testing, biopsy, CT, and MRI scans. After diagnosis, patients must be frequently monitored based on the specific risks associated with each condition. NF1 patients should seek urgent medical advice if they develop persistent pain lasting for longer than a month or pain that disturbs sleep, new or unexplained neurological deficit, alteration in the texture of a neurofibroma from soft to hard, and rapid increase in the size of a neurofibroma. Annual brain MRI is recommended for tumor surveillance in NF2 patients. Furthermore, a multidisciplinary care team is essential for addressing the complex needs of NF and schwannomatosis patients. This team may include neurologists, oncologists, surgeons, genetic counselors, pain specialists, and physical therapists. The risk of developing cancer can be effectively managed by surgical interventions, radiotherapy, and chemotherapy. Patients and families will also benefit from genetic counseling on inheritance patterns, causes of spontaneous gene mutation, and cancer risk.